Well, the playoffs are over. Tkachuk, Barkov, Rienhart, they all revealed that they were playing with some injuries throughout the Stanley Cup Finals. Welcome back, everyone. My name is Dr. Stephen Wilson, and here on this channel we analyze the science of sports injuries. So if that's the type of content that interests you, then please consider liking and subscribing to this channel. Tuesday night after Game 6, Matthew Tkachuk, Alexander Barkov, and Sam Rienhart, they did reveal that they were playing with some injuries throughout the Stanley Cup playoffs. We're going to take a look at all three injuries. We're going to start with Tkachuk here with what we had described as a groin injury. Now, he did reveal back in February after the Four Nations face-off that that's when the injury originally occurred, and they were calling it a groin injury. He did confirm that Tuesday night that he was playing with what he described as a torn adductor muscle and a quote, some sort of hernia. So we'll take a look at the anatomy screen and I'll explain exactly what that means and what type of injury Tkachuk was playing with. So here on this screen, we can see the musculoskeletal system, the pelvis, and the proximal or upper lower legs consisting of the thigh region here. We're going to pretend this is Matthew Tkachuk. He described how he had a groin injury affecting his adductor muscle. So what that is, adductor is going to mean on the inside or more on the medial side of the leg. There's three specific adductor muscles, and we're going to talk about all three of them here. The one at the top, the most proximal, it is also the shortest. In Latin, you're going to call that the brevis muscle. This is the adductor brevis. And then right next to it, we're going to have the adductor longus muscle. And then right beside that, we're going to have the adductor magnus muscle. We can see how they share attachment points into the femur or the thigh bone, and they all run proximally, they all run superiorly up towards what is called the pubic bone, and they all insert into the pubic bone. They share a common attachment point there with the lower part of the abdominal muscles. So when Matthew Tkachuk described himself as having a hernia, what that means is a sports hernia. Similar to what I did report back in February, similar to a video I did last year, a similar injury suffered by Evander Kane prior to the playoffs. When Tkachuk describes he has a torn adductor muscle, now he didn't state which one of the three it was, but we would assume it would be the adductor longus. That is the most commonly injured muscle, the most commonly strained, and the most commonly irritated at that point of attachment into the pubic bone. It's the most commonly aggravated muscle because it also has a medial or an internal rotation component on how it influences the movement of the thigh bone. But either way, that's one of the inside groin muscles, one of the three adductor muscles. Tkachuk claims that he did tear and he has a hernia, meaning part of that tendon, the tendon of the adductor longus muscle, would have been irritated, strained, or even torn off of the pubic bone here. That is a very painful injury to go through, most likely requiring surgery, and it's going to take a fair bit of rehab before Tkachuk can return to NHL play. Training camp kicks off in September of 2025, and I'd be surprised if Matthew Tkachuk is 100% by next September. This is a lengthy healing process is needed. I would suspect Tkachuk will be healthy further into the 2025 NHL season. And the second injury that was talked about on Tuesday night was number 13, Sam Rienhart of the Panthers. He was alluding to his left knee injury that he suffered in the Eastern Conference Final against the Carolina Hurricanes. So on this replay, we can see number 13, Sam Rienhart carrying the puck over the blue line, and then Sebastian Aho comes in with the hip check, leading with his left hip, is kind of his buttocks area there, and we can see him making contact with the lateral or the outside portion of Sam Rienhart's left knee, and that is going to be called a valgus stress, when a force comes from the outside or the lateral component pushing his knee and buckling it inwards, therefore stressing the inside part of his knee. Typically that'll be your medial meniscus, MCL, and your anterior cruciate ligament, your ACL. Most likely his MCL is going to be stressed on this play, as I reported about 3 weeks ago in another video. It does kind of go out of frame here, but we can see the after effect of the buckling component of Sam Rienhart's left knee, that valgus stress forcing his knee to buckle inwards, and he did reveal on Tuesday night that indeed it was his left MCL that had been injured on this play. Paul Maurice, Panthers coach, did say, he mentioned it was a grade 2 sprain of his left MCL. Sprains of a ligament is a tough piece of rope that attaches bone to bone, and in this case the ligament certainly was stretched. There would be a little bit of tearing or a partially torn component to the ligament. He's gonna have pain. There will be swelling, bruising. He certainly will had his range of motion decrease and affected as a result of this injury. There would also be a grade 1 and a grade 3, of course. There's 3 different rating scales to a ligamentous sprain. A grade 1, which is more mild, the ligament is stretched. Perhaps maybe there's a little bit of tearing, some microscopic fibers could have been disrupted. There'll be pain, there'll be swelling, but certainly not as much as a grade 2. And then a grade 3, you have the complete rupture of the ligament, which will require surgery to repair. Sam Rienhart, it is impressive that he was able to play so effectively with a grade 2 sprain of his left MCL. Now he does have the off season to rehab that and come back strong for training camp in September of 2025. Paul Maurice also mentioned after Game 6 that Captain Alexander Barkov, he took a puck to his hand in Game 1, which opened his hand up and needed 15 sutures to close a laceration on his hand, which apparently kept breaking open throughout the series, and they finally resorted to glue instead of sutures in order to close that wound. Glue is typically used more for superficial wounds, where sutures are preferred to line the skin up a little bit more accurately and for deeper wounds. He should make a full recovery by training camp of, again, September of 2025. Thank you very much for watching today. I really appreciate your time. Please be well.